Hello everyone, I'm Dr. Ushna Naveed. I'm FCPS dermatologist and I have recently cleared my AMC exam. Today our talk is very important. We are talking about the PCOS, which is Polycystic Ovarian Syndrome, but recently the new guidelines has changed the name into the PMOS, that is Polyendocrine Metabolic Ovarian Syndrome. This topic was extremely important for the exam in the previous recalls as well, but now it has led a very important significance because the women health is a very important part of your 2026 exam overall. So, what is PMOS, polycystic ovarian syndrome, or the polyendocrine metabolic syndrome? This is a very important topic. First of all, it's an endocrine disorder that occurs about 6 to 10% of all the women. That means this is not very rare topic. This is a very common topic among all the females. Like if you are examining 100 females, there are very high chance of having PMOS or PCOS in 6 to 10% of the females. Then by definition, we have three very important criteria that is known as Rotterdam criteria. Rotterdam criteria is extremely important for your exam. Patient is having chronic anovulation. She is having hyperandrogenism. By hyperandrogenism, she can have hirsutism, polycystic ovarian syndrome. She can have acne. She can have irregular menstruation. Anything can be a causative factor of this hyperandrogenism. Then she has polycystic ovaries on ultrasonography, very important one. See, these are the ovaries and they have multiple cysts on the ovaries. So the polycystic ovaries on ultrasonography is a very important feature of your PCOS. That was earlier term, now we call the term PMOS. Okay, polyendocrine metabolic syndrome, and this is a complex disorder. Then based upon pathophysiology, remember pathophysiology is not extremely important for your exam, but very important thing is you should remember all that is culprit causing PMOS or PCOS, that is insulin resistance. So if the patient is having insulin resistance that is evident by high insulin level, that is indirect clue that the patient is having PCOS. Okay, this is extremely important in diagnosis of your PMOS condition. Clinical features can vary among the patients. It can have irregular menstruation, it can have hirsutism, acne, hair fall can be a cause, weight gain can be a cause, infertility is a very important cause. Infertility can be a presenting symptom of PMOS also. We do not call it at PCOS now because the name has been changed in a recent guidelines, in updated guidelines, it has become PMOS. So focus on the PMOS for your exam purpose. So all are these clinical features of your PMOS. Then this is a Rotterdam criteria. Rotterdam tells you that any of the two, this is very important to understand, any of the two features should be there, because in exam mostly they will mention that the patient is presenting to you who is having irregular periods or she's not able to conceive. Then how you are going to diagnose the condition PMOS for sure? So what should be your investigation? And in options they have ultrasonography, they have FSH, LH, androgens, and no investigation mentioned. So remember, we only need two criteria. We do not need three of the criteria to fulfill the patient as labeling the patient as PCOS or PMOS. So if two criteria are mentioned in the question, your answer is going to be no investigation needed. Rather than selecting your enzyme levels or going for ultrasonography examination, you will select no investigation needed. This has repeatedly tested in your AMC exam, very important criteria. So Rotterdam criteria, just remember two of the three should be there for the diagnosis of PMOS. Apart from this criteria, we have many investigation. You look for the hormonal profile, you look for ultrasonography, and very important for your AMC exam, they want you to make a safe doctor. So you do not just label the patient as having PMOS or PCOS by not excluding the other differential diagnosis. So this is extremely important. You have to exclude the other diagnosis, then you reach the diagnosis of PMOS or PCOS. This is a very neglected part of our training, but this is extremely important. Okay, you have to exclude all other differential diagnoses. That can be congenital adrenal hyperplasia, that can be prolactinoma, anything. Okay, so all the endocrine metabolic disturbances, even your thyroid function, they should be excluded before labeling the patient as having PMOS. If you are not understanding the condition. If you are ignoring the patient or the patient is not getting the treatment, then these are the complications the patient can have. The patient can have infertility, pregnancy complications can be there, type 2 diabetes can be there. Metabolic syndrome is a very, very important problem or complications of your PMOS. Then endometrial hyperplasia, even carcinoma can occur. And psychological issue is a very major issue which is mostly neglected, because the patient is not able to conceive, patient is going through weight gain, patient is going through cosmetic changes like acne, hirsutism, hair fall. So everything is just impacting the life so badly, so negatively. Anxiety, depression is the part of your PMOS. Then how you're going to manage the condition, that's very important. So always start with a lifestyle modification. That is going to be your first line treatment. Weight reduction is extremely important. Even according to studies, if you reduce to 5 to 10% of the weight of the patient, that is going to make a very, very major difference in the fertility treatment and your overall management of insulin resistance. So 5 to 10%, even that is very, very important weight loss. Then control of symptoms, whatever she's presenting with. And last one is your fertility medications. Among the lifestyle modifications, the patient should be encouraged to have a healthy diet. Just she should not take processed food, sugar, that all the white bread or anything that is refined carbs, basically low glycemic index food, she should avoid that. Then physical activity is very important, at least 150 minutes, okay, per week, that is recommended. This is extremely important for your exam, that 5 to 10% of the weight loss can improve the reproductive outcome, can improve your metabolic outcome, very important. And the last one is stress management, because stress is negatively affecting your body and you are not aware of that. Stress is increasing cortisol level into your body, so you have to manage the stress as well. Then comes pharmacological treatment. If the patient is not controlled on the lifestyle modification, then you're going for the that hormonal contraceptions to regulate the cycles if the patient is having irregular cycle. Insulin sensitizers in the form of metformin to improve the insulin resistance. And hirsutism and acne can be controlled by the spironolactone. If the patient's problem was infertility, she was not able to conceive, then your option is going for letrozole or clomiphene. These are basically your induction medication. They induce the ovulation in the ovaries. So letrozole and clomiphene is the preferred medication for induction. So step by step approach is very important. So that was all about your PCOS. Okay, so PCOS, just remember, that is no longer called it PCOS. This is known as PMOS. You should be familiar with the name, because in exam now the question is coming as topic of PMOS, not PCOS. That is very, very important topic for your exam, earlier also, now also. The major change is just in the name of the disease. Other conditions of the disease and classification criteria, this is exactly the same. So that was all about your PCOS. Very important, concise talk. You should remember this topic, okay? That's extremely important for your exam. If you want to join the group, that is AMC Smart Prep, this is a Telegram link and this is a WhatsApp group link. This is a scan code, QR code. You can scan and join the WhatsApp group as well. And there are paid courses also available there. We have free courses also running in the groups. So join the group for the better understanding of your AMC exam. That is a very, very focused study based upon the guidelines. Stay tuned for the latest videos. Thank you.